Hi, everybody. I'm Becca. I'm a pediatrician,
I'm Andrea. I'm a lactation consultant.
and we are the Coddle team. We're here to talk today about pumping and all the trouble we can get into with pumping and some ways to strategize and help with that. We have the chat open. Please feel free to drop any questions into the chat. We'd love to hear from you. We're going to run through a few slides first, and from there, we'll start opening it up to Q&A. We do want to make sure everybody knows that we are not actually here to provide medical advice. We are here for information and education purposes. We are professional licensed people, but this is not setting up for a doctor-patient relationship, but we are here to talk all about it. So we want to hear your questions and answer as best we can.
Yes. Cool. So just quickly going through the highlights of the presentation. So the main topics that we're talking about is why pumping can be tricky, the top 5 pumping pitfalls and how to fix them, when to seek help, final resources and notes, and then we'll get to our live Q&A. So hopefully this presentation will just be about 15-20 minutes.
All right, so why is pumping tricky? I think the main reason is because it's a pretty awkward thing to do. You've got a part of your body that is doing something new for most women who are pumping, which is breast producing milk. And then you have this whole apparatus, and there's several different types of pump. There's lots of different parts to figure out how to use. It's really not a very comfortable process. So it takes some time to learn your pump, to learn your body. It really can be pretty frustrating, especially at the beginning. And then we just also remember feels pretty stressful for a lot of women because you are really trying to feed your baby. You really want the best for your baby. And can be really scary when it's not working well. It can feel really overwhelming. And there's a lot of misinformation out there, which is part of what we're here for, is because we want to be able to provide good information from credible sources. So hopefully that's us.
Yes. And for the natural part, like I've heard so many times with my clients that it feels like really mechanical and, like we don't like to describe ourselves like this, but like we're pumping like a cow.
Yeah.
Like we're just hooked up to a machine.
Hanging at the dairy. Yeah.
Yeah. And this, for some people, is not how we envisioned this early postpartum going. So it can feel, really mechanical, not very natural and bonding, but there's ways to set yourself up for success for that and to kind of reframe your mind where this is expressing milk to give our baby, the best start to life. And if it doesn't work out, that's okay too. But yeah, we're here for you with all the questions and all the troubleshooting.
So our top 5 pumping pitfalls. Number 1 is a pump that does not fit right and misusing the settings. So that 100% happened to me. That's part of how I met you. Choosing the wrong pump. So there's so many pumps on the market right now. This can be really tricky too, because are you getting a pump for when you're in the office? Are you getting a pump for at home? What is going to be the best option? Do you need a hands-free or not a hands-free? The third is actually something I see a lot in the office, which is pumping too much or too little, where we're really trying to match the baby supply, and that can be hard to figure out. Poor pump maintenance. This is a machine. We do need to keep it working. And then probably ultimately what I see as the most challenging is that there's a lot of stress around this process for a lot of people, the sense of unrealistic expectations and comparison. There's a lot out there about, oh my gosh, I make so much milk, and you're just barely keeping up with that baby. It can feel really stressful.
Yeah, and it can feel like you're the only one. Like, why isn't it working? And the other, in the way that it works for
and
other
I think
people.
unrealistic expectations is also just about like, how old is your baby? How far out are you in this process? Why are you pumping? There's a lot of reasons that can change how much milk you're going to be producing at any given time.
Yeah.
Yeah.
Cool. So getting into the pumping pitfall number 1, poor pump fit and misusing settings. So the main things are flange sizes, the type of flange, and then the settings on the actual pump. So put some things up here on the screen. Just quick about measuring the flanges. So we want to, is my cursor showing up? Okay, not really. In the top right, it shows, actually I have it here, my little puppet here, and my little ruler. So you can get these off Amazon. We use this in our last webinar. So crochet boob and then a nipple ruler. You can get these on Amazon. You can also just like use a soft nipple ruler. And you want to measure right around the base of the nipples. So the part that's erected out, if you have inverted nipples, see if you can kind of like pinch the sides and kind of pull it out. But you really want to get to the base of the nipple. And I would say measuring the nipple is the first start of finding the right size. So I think with this one, it might be this one right here. So 19 millimeters.
Yeah. And I want to say really clearly, the size of your boob and the size of your nipple don't have that much to do with each other.
Very
Those can be
true.
very different sizes. It does not mean if you have smaller breasts that your nipple is going to be tiny and vice versa. So it is definitely worth measuring this.
For sure. Yeah. So measure and try to find the closest the fit right against the base of the nipple. And then so 19 millimeters. And then from here, it's up to you. You can, go on Amazon, go to the store, look online and find flanges that are this exact size and start from there. What I really love, totally different flanges. I love the silicone flanges. This is the Lactec flanges. This is the pump and pal. This is small and extra small. These are all fully silicone. They're usually much softer, more comfortable. They don't have the sharp, like right angle that the other hard plastic flanges that come like with the Spectra pump, the Medela pump. So I usually recommend for people to maybe look into other options. There's also different size hard plastic flanges you can get on Amazon, and those are usually pretty affordable that you can try different options.
Can you just show us how this actually looks on the boob?
Yeah, totally. Okay. So here's a Lactec flange. Again, silicone one goes right like that. So the nipples should go right into the tunnel, the center of the flange here. And yeah, so what I usually do as a lactation consultant is kind of bring some options to clients' house. We choose some to start with, and then we just kind of rotate through, find the most comfortable and the most effective. So both those things are really important. Just so you know, too, if you're kind of looking at this and you're like, how does this even attach to my pump? You might have to get this adapter piece. You can get these online too. And this essentially, these two pieces will replace the flange part that comes in your pump box. And then
tube goes out here.
Yep, the backflow and tube, the valve, and the bottle. So this piece, these two pieces will replace your flange that comes with the pump. And then this piece also fits on the pump and pals. So long story, start with measuring your nipple first, get a good baseline, and then you can either try that exact size and some different options, or you can even pump and pals. I don't know if you've noticed, if you know this, but they have like bundles you can buy, or you can try all these at home. It's kind of expensive and it can be kind of wasteful. What Becca, we were just talking about earlier is sometimes there's lactation consultants or boutiques or baby stores or clinics that have demo pump parts where you can actually pay for a pump consultation. You can try all the flanges with them in the office, and then you can find the right fit. But comfort and effectiveness are the two main things you're looking for flanges.
Can I ask a question?
Yeah.
So we know that breast size changes a ton between before you have the baby and after you have the baby. Does the nipple size change, or can you actually do the measuring before you have the baby?
Yeah, that's a great question. So I'm kind of split on that because so what I've seen is it very rarely changes, or it's a small amount of change unless you're measuring or using different flanges during your engorgement time where the breast is really swollen, the nipple can be pretty swollen. But I've had people anecdotally tell me their nipple size definitely changed, like different pregnancy, like different postpartum times of different babies, or in pregnancy and postpartum it's changed. But I really haven't seen it change that much.
So it would be potentially worth doing this before you have a baby.
Yeah, I do. Yeah, quite a lot of flange fitting, but just make sure it's the late pregnancy, like after 36 weeks if you're doing this, and you get approval from your midwife or OB if you're actually going to try to pump and test different flanges. But yeah, I like to do some troubleshooting beforehand so that you feel more prepared. So it's just one less thing to learn on the job when you're with your baby and healing and trying to figure it all out. So wrong flanges can really make or break your journey in terms of comfort and effectiveness of your pumping. Also, you can experiment with lubricating the flanges or your nipples. That can also make it really comfortable. There's lots of guides out there to kind of tell you how far or like the space around your nipple into the flange, but I like it to be pretty close. It's okay if it rubs against the side of the flange as long as there's no discomfort and it's effective. We really don't want much space around the nipple and the flange because it can make the areola swell over time. So if there's a lot of space, it may look like, oh, now it's fitting as I'm kind of working through the pump, the pumping session, but really it's the areola swelling and kind of filling that flange, and so it can create inflammation. So pretty close to rubbing against the side or just a little bit of space. But long story, try different options. Maybe start with measuring to get a baseline, potentially do some lubrication, just like a nipple cream or coconut oil works. You can either lubricate the flange or the nipple. So I would say that's the number one troubleshooting that I start with, at least, is a proper flange fit. Flange fit, and then the settings on the pump. So all pumps work totally different. I put on here a little guide for the Spectra pump, the toggle between expression and massage, but there's a lot of nuances here. But a general rule that I like to recommend is to use the massage mode. Different pumps call it differently, but maybe the letdown mode, the massage mode, the stimulation mode, but it's the fast cycle that's really light suction. You use that for about 2 minutes to help stimulate the letdown. And then once you have the letdowns, you start seeing more milk flow, maybe spray, maybe just lots of dripping. Then you want to rotate the mode to expression. And then that's the mode that you finish your whole session in.
Good.
So maybe 2 minutes massage or until you get the letdown, and then the rest of the time in expression. Everyone has different ways of doing it, but I like to say maybe like 10, 15 minutes in expression. A full session, maybe about 20 minutes. I say up to 30 is like the longest that I usually recommend, but most people can get the most milk in the first like 10 to 20 minutes.
Yep.
Great. Did I get through everything? Yep.
Yeah.
Perfect. Okay. Awesome. And then choosing the right pump. So again, lots of things on the market. It can be really overwhelming. So I have my personal favorites and I've tried a lot with clients, but I haven't tried everyone and everyone responds differently. But in general, you want to find the pump that matches your actual needs, what's going on with your milk, and then your kind of lifestyle needs. If you have a low supply or you're building a supply, or if you're exclusively pumping, like you're using this pump a lot, hospital grade pumps can be amazing. I typically say that they're the Cadillac of all pumps. In general, if no other pump is working or you can't find a good comfort level or good efficiency, I love the Medela Symphony. I find it super helpful. It can be expensive if your insurance doesn't cover it. It's really bulky. It's a plug-in only pump, but it is so great.
Yeah. And don't be put off by the price tag. Most places will rent these. This is not something that you would buy.
Yeah, it's like a $2,000 pump. Yeah.
But it is great. So yeah, I was using another pump and then I actually had to go back to the hospital and tried this in the hospital for other reasons. And I was like, oh my gosh, this pumping experience is so easy. It is bulky. It is not convenient. You have to plug it in and stay in one spot. So there's a lot of downsides to it. But in terms of actually the pumping experience of getting milk out and being pretty comfortable doing it, it's a pretty awesome option.
Yes. Yes. Yeah. So I love, considering a hospital grade pump for those scenarios or a high quality electric pump. A lot of people can use, I put the Spectra on here. That's one of my favorite ones. It's the S1. Any of the Spectra pumps, they are a little different, of course, but I love in general the Medela Symphony and Spectra for like building supply or exclusive pumping, just doing a lot of pumping. And there's some rechargeable ones with Spectra, which is more convenient. If you're going back to work or on the go, especially if you have a great milk supply, wearable pumps can be great. I usually say like as the primary pump, unless you are just flowing with milk and it is really easy for you to express a large quantity, then those can be great and they are so convenient. But in general, I find that not everyone can get the right fit with those or that they're efficient enough to be the primary pump. But that can be something that you can look into. Another downside that I find is they're really expensive. So if they don't work for you, it can be a hard pill to swallow if isn't the right fit for you. And then of course there's other rechargeable ones that are kind of in between, like more effective than a wearable, but not quite a hospital grade pump. And then for occasional or passive milk collection, of course, the Haka hand pump silicone collectors can be really convenient, but again, wouldn't be like the primary way you would express unless you, again, are just blessed with a ridiculous supply. And if you think about your breasts, they're just pouring. It's lots of pumps on the market. You can talk to your friends, but everyone's experience is so very different. But I would say in general, Spectra or the Symphonies tend to be, I think
pretty well.
Yeah.
Yeah, and I will also say most insurance companies have to cover breast pumps at this point. And so thinking about this as if you have the ability to buy one that's like, you're going to be going back to work, you want to get an express, like a wearable one through the insurance company that's more expensive, and then maybe get a cheaper one as another option. That also sometimes is a better way to go. So get the value out of your money for your health plan.
Yes, yes.
Okay, so Andrew's alluding to the fact that women have very different supplies and babies have different needs. So I think one of the things that I will often see in the office is women coming in who are like not quite aligned with their goals in terms of how much they're pumping and not quite aligned sometimes with what their baby needs. This is particularly an issue when you're really trying to build milk supply, when we see that people pumping too little or too much can really push you in one direction or the other. So pumping too little, if your baby is little, like in the first month of life, and you're trying to make a transition, maybe you did a little formula as a bridge, or your body, for whatever reason, maybe like me, you ended up back in the hospital, there's something else going on that you need to really push to get your milk supply up, pumping at least 6 to 8 times a day is really, really important to be able to do that. On the other hand, if you're super engorged and you've got milk squirting out of you at all hours of the day and night, pumping 8 times a day, you're going to be available to feed like triplets. And that is not what we're looking for. So breast milk production is all about supply and demand. If you have emptying of the breast, it stimulates your body to be able to produce more breast milk. And that upregulates the more often you empty the breast, and it downregulates the less often you empty the breast. So if you're trying to match your baby, being aware that you're going too far in either direction is really not helpful. So 8 times a day early on is really recommended for kicking up your milk supply, unless this is like your third baby or you've got some other reasons to just have a ton of milk. Dropping that down like pretty quickly, I think is helpful. And I think once you find a pretty stable place, a lot of people will find they kind of produce the same amount over that course of 24 hours. If they divide it up into 6 pumps, it's a little bit less each pump, but if they divide it into 4 or 5 pumps, it's a little bit more. Pumping less than 3 times a day, if you're not also nursing, your supply is going to start to drop. So I think this is, again, something that is all about trial and error. There are a few basic rules. If you're trying to kick that milk supply up, more pumping. If you are realizing that you are just like producing a ton, and I'll sometimes see this as people make that transition. They had a baby who wasn't eating a bunch. Their doctor, their lactation consultant told them to start pumping after every feed. Their baby woke up, they were hungry, they were emptying the breast actually pretty well. And then mom is putting on the pump again, and suddenly again, she's feeding twins. And that's not a comfortable position, unless you in fact are feeding twins, in which case, good work. So I think just, again, paying attention to this, you can sometimes, we are so tired this first couple months, it's easy to be like, oh, it's time to pump again, but really thinking through what your goals are, especially if you're noticing any of those problems, either too much milk or too little milk.
Yes, yeah. And just to add on top of that, I almost never recommend more than 8 times a day, even if you have a low supply. Like 8 times seems to be the highest that it's somewhat sustainable. I know in the hospital sometimes they say like pump every 2 to 3 hours if they suspect a low supply. But that is pumping more than 8 times is way too much. And they end up getting way too stressed, overwhelmed. You can't get enough sleep with that. So I would say like 6 to 8 is the sweet spot that I find that most people settle in if they're exclusively pumping or really pumping to stimulate their milk supply. So yeah, and then the only thing I'll add for the pumping too much is I really do recommend working with a lactation consultant. Maybe your pediatrician or OB can give you some guidance, but lactation consultants are really trained in how to manage oversupply, and there's lots of actually mixed information out there and misinformation. So working with an expert that's really up to speed on like the most recent protocols is really helpful. The main thing I'll just say is like, don't over pump or use heat. So ice and trying to use and do less pumping, but still in a way it's a fine balance. So long story without getting into it, find a lactation consultant if you're producing more milk and need to manage the oversupply.
Yeah, 8 times is a lot of times. 12 times your nipples are going to fall. No, that's not true. But it's going to be really uncomfortable. So yeah, 8 times is a lot of times already.
Yeah.
Because you still have that baby around that you're hopefully that you're trying to take care of. And so yeah, you got other things to do with your time.
Yes. Yeah.
Okay, pumping pitfall number 4. One of the like most sad moms I have seen in my practice came in and was like, "What is this in my pump parts?" I was like, "Oh my gosh, that's mold." This is something that I think is super important to realize. These are machines. They do wear out. There can be mechanical failures that are making, for whatever reason, you're just, why am I suddenly not getting much in terms of supply? Sometimes that can really just be a mechanical issue. And often as women, we're like, "Oh, it must be something I'm doing wrong." I was like, no, check your pump. So I think this is a super important thing to be aware of. These parts are not made to last the full year that you're breastfeeding if you're managing to breastfeed for the first year of your baby's life, and especially if you're pumping for that long. So really thinking about in after even just like a month, you want to look for those little valves. You want to try and change those out at most every 3 months because they really do get kind of sticky. They get a film on them, and you are going to obviously you're going to wash them. You're going to clean things very thoroughly after you use them and store them properly. But they just get a lot of use, and those are the moving parts of the pump, so it really matters. The backflow protector, again, it's a damp process. You want to just make sure you're doing a fresh one. The flanges actually last the longest. Those are okay to think about replacing just about every 6 months. And then one of my pro tips for the tubing is going to be to let the pump run for a minute or two after you're done pumping, disconnecting yourself if you're using
an open system,
like
the
yes.
Symphony.
Yes, that was what I used. So of course that's what I think you should do for everybody, to just like let it dry out, because we really want to make sure that you're not coming in with mold, because that's a sad moment. And then washing pump parts, this I would definitely recommend, don't put your pump parts right in the sink where you wash all your dirty dishes. Get a little basin and trying to pull everything apart. We get our little scrubby brushes in there and do hot soapy water. Yes, and a really, really good rinse is super important too. And if you're doing the fridge trick where you're keeping your pump parts in the fridge and just doing a big wash once a day, most people will do like just a little rinse at least after they use the pumps.
So in general, just to add to a little bit of that, the silicone parts need to be replaced earlier. So the valves, maybe the backflow, the valves and membranes for the Medela pumps, like the one on the screen here. So the silicone ones tend to wear out a little faster. In general, I like to say like the duckbill valves, that there's a little opening. If it kind of has a little space, that's usually a signal that you need to replace those. Legendary Milk makes those like way more expensive or way cheaper. It's like a 6 or 8 pack for like less than what the Spectres are for a 2-pack. And they have a little pull tab, which is so nice because those can be so hard to take out. So yeah, valves I usually find to be replaced a little faster, and then the backflow. And then tubes and flanges maybe never, but if it's like things start to, if you use like sterilization or put them in the dishwasher, they can warp the part. So if they're not fitting right, or you're losing section, or supply just seems to take a little turn, you might want to look into those. In general, I recommend do not get the tubes wet. They take forever to dry or maybe impossible to dry. The Symphony is nice because you can keep them plugged in and run it through. So that's nice to clear those out. So I usually say with that one, when you take off the pump parts, just leave the pump running, keep the tubes attached while you're washing, and then come back to it and unplug those. And yeah, I think you covered everything else. Perfect. Cool. So, stress with pumping. In comparison, this is the hardest one for, I would say, people to manage, and for us as lactation consultants and pediatricians to just see that spiral happening. And I totally understand, but I just want to like support them so much because it's such a stressful process and you're doing such a great job. So it's hard to see, parents struggling at this point, but pumping is so hard to manage, especially when you're doing it pretty frequently and have a newborn that you have to take care of, because especially when your partner goes back to work and you're trying to figure out how I'm going to fit in these pump sessions with caring for my baby and then taking care of myself, like what? There's like absolutely no time for this. So just to validate, it is so hard, especially when you're pumping quite frequently. In general, I like to say, be gentle with yourself and realize that you are doing an amazing job. The pumping that you're doing, you are pulling out milk from your body that is just full of antibodies and protection for your baby, the very best that we could give for them. So really try to be gentle with yourself and realize that you are making a huge kind of like sacrifice for your time to do something really amazing for your baby. And I always find like when I have a hard time giving myself grace to like think of your best friend, like what would you say if your best friend came to you with all of these concerns or worries or self-criticisms? Like you would be like, you were doing amazing. So really be gentle, give yourself grace, and just take it one step at a time. And I like to remember that sometimes the social media comparison spiral can really get in our head and make us lose joy and like lose focus on what we're actually doing and why we're doing it. So if you need to kind of like unplug from social media or maybe like follow other accounts or unfollow accounts just so that your feed is like really tailored to what's supportive and encouraging, that can kind of be a game changer for like mental health, and really changing your perspective can change everything. Try different routines that feel good for you. So, try to experiment maybe with spacing out your pump sessions a little bit. If you were doing 8 times, see if you can drop one at night, space them out equally. So you can do like 6 to 7 times, like find what works for your production, for your goals, but also your lifestyle. I like to, I would ask you your opinion too, since you did a bit more pumping than I did, about lost my train of thought. Like how to make the pumping sessions more enjoyable and not like so stressful.
Yeah, I watched Succession.
Okay, because I usually like
kind of a grim show, it turned out, but it was very entertaining.
Yes.
I actually had to like truly stop using social media while I was pumping because it was too stressful. So I think we talked at the very beginning about like you kind of feel like a cow because you're attached to a pump. You can't really move around that much if you're in one spot, or you're like just very awkwardly wearing these things.
Yeah.
I think we also underestimate a little bit how much a baby on your body physically helps with letdown. So letdown is not just mechanical stimulation. Part of it is like that release of hormones that happen when you're snuggling with your baby. So for sure, I found that like the more stressed I was, if I was just doom scrolling on my phone, it was actually affecting my enjoyment of the experience, but definitely also my production.
Yes.
And I found that when I went back to work, and I think that's something I tell all the parents when we're talking about this transition is that pumping break is not your catch up on email time. That pumping break is your like, look at some sweet photos of your baby, dim the lights if you can, like let your body relax, because that relaxation response is going to let the pump experience be a little easier and your milk supply will be better. And I nursed as well as pumped. At the beginning, I pumped a lot. And then as my son got older, I was able to switch to more nursing, but I was back at work. So I was still pumping then. And the experience of actually nursing a baby, your body does, if things are going well, it does relax. And that's finding a way to duplicate that to let that hormonal shift happen for the letdown, I think is really important. So I think just being really chill. I was also going to try and find a picture for this that I was not able to find beforehand, but it was me pumping like this much milk. So I think the other thing is expectations wise, how much milk your body is going to make is really going to depend on how old your baby is, how far out from postpartum you are. Did you have a complicated delivery? Did your body undergo a ton of other stress for whatever reason? We also don't always talk about this, but how old you are when you are nursing for the first time, and whether or not you had to have like an IVF pregnancy or use additional support for pregnancy can also make a big difference. So I'm an older mom. It definitely took me a while to get my supply going. I think that what I found was that making the pumping just as much just like a part of the routine as possible, where it was just like, I'm going to focus mostly on taking care of my baby, but it took me a while to get there. And I think just like finding what is relaxing. And I still remember like having my son in the bassinet, my feet up in the big nursing chair, hanging with the pump and just like watching a show. So I think that like letting yourself relax and getting off your phone can be really, really helpful.
Yes. Yeah, great. A couple things. So, like practically getting backup pump parts, I think can be a game changer. So just less washing, like less stress, just like delegate and try to plan for success as much as possible. So maybe your partner can help with washing pump parts, doing the sterilization for that, setting it up potentially, especially if they're still at home. When they go back to work, maybe they can still be the one that does that. If you're doing the fridge hack, still does that like once a day washing. That would be really helpful and useful. So really like express your needs, check in with yourself and relay these things to your partner, your support system, whoever that may be. But getting backup pump parts can be really helpful. Even if you're like, oh, this is, if you can swing it, it can really kind of like extend your journey actually as well. And then I like to recommend to not watch the pump, especially if you're building your supply and get really stressed with that. So trying to, I don't like to say check out, but like kind of do something else that's really enjoyable.
I also got like the tiny bottles. So when you have the bottle that comes with the pump, it's like 4 to 6 ounces. And let me just tell you, no one is pumping 4 to 6 ounces. Not nobody, but very few people are pumping 4 to 6 ounces in the first couple of weeks of pumping. It is like you're pumping milliliters. And if you're looking at 4 ounces and you're pumping 5 milliliters, it feels very disheartening. But I got these little guys that were like 10 to 20 milliliters. And I was like, oh, look at me. I filled up a whole little guy. So it was like a way to feel more positive about it and see progress. Because when I had to switch to the bigger ones, it was like, oh my gosh, this is amazing. So, but yeah, it took a good chunk of time to be able to get that milk actually up.
I love that idea. I love when you said like, look at me, look what I did. Amazing. Cool. Great. Cool. So ways to know. Sorry, we have washing installed today. Perfect timing. It's great. Do you want to take this one?
Yeah. So I think when to reach out for help, as usual, our answers can be early and often. You are building a team to take care of yourself and your baby. So if pumping is really painful, it's not everybody's favorite thing, but it shouldn't be persistently really painful. If you are doing everything you can and you're still in the tiny cups and you're feeling like you just can't make good progress there, definitely if you're feeling like you just get clogged ducts every time you're pumping, you're having any redness or pain in the breast, especially with a fever, those are signs potentially of mastitis, and just an infection in the breast. You definitely want to see your doctor about that. And then if you're just hitting that mental wall, I, definitely had families where we've had the conversation of like, this is your time with your newborn baby. And if pumping feels like it's too much and it's not adding to your experience, but it's really taking away, one that can be a flag for some postpartum mental health issues for sure. If you're spiraling about every drop that comes out of the pump, if you're labeling every pump bag with what time of day beforehand, you might be hitting an anxiety moment that's not helpful. So if that's starting to happen and it just feels like a lot of every time you're pumping, I think that's something that's super important to bring up to your doctor too, because I think the cost benefit here, it does take a lot of time. It takes a fair amount of money. It takes a lot of setup. And especially if you have older kids at home, or you have to go back to work really early, or you have the kind of job where you're just running around all day, there's a lot of ways that pumping can end up feeling like it's just not manageable. And our job is to talk to a lot of people about it and maybe have some ideas that you haven't thought of, but also sometimes to talk about like, well, what are the ways that we want to be feeding your baby so that they can grow and thrive, and also so that parents can feel happy along their journey of feeding their baby as well.
Yes, yeah. And I would just add that IBCLCs, or any, especially like pump experts, like there's some people that aren't IBCLCs but are really good at pumping. If you've done a lot of troubleshooting, especially if it's just been on your own and you're not getting to your goals, or you are just really uncomfortable, I would highly recommend you reach out for an expert opinion. And if that still doesn't produce what you're wanting, not necessarily production, but like the comfort or finding more efficient expression, maybe you can look into someone else. But I've had people come to me where for months, even like 12 months, I've had people come where they have had a uncomfortable, maybe not necessarily painful, but also people that are like bleeding for like months. And then they're like, this is just what I thought, was my journey. Whether they just listened to all of their friends' opinions and tried out those things, or actually did reach out to experts. But I've had people that have kind of like gone down the rabbit hole and just really were really hopeless about it. And then we were able to find the right pump, the right fit, the right routine for them, and really get them on a better trajectory. So there's a lot of support out there. Sometimes you just have to find what's right for you and what's accessible for you, but you don't have to do this alone, and you don't have to grin and bear it throughout pumping. It can be a better journey. Maybe not what you would, most people have like little ceremony after they're done pumping. Like even if it was a positive thing, like they're ready to be done. So it's maybe not going to be like the most enjoyable thing, but it can be better. Yeah, for sure. Great. So just some resources on the screen. AAP, CDC is great. Leche League is really helpful. I love Kelly Mom. She's an IBCLC. She has lots of blog posts that you can search through. There's local groups, hopefully, in your area. Of course, IBCLCs. You can just Google, IBCLC in whatever city that you're in, or ask your friends.
Pediatrician, we should know. We should know if
you should have some good support. Yeah, and resources. Great. So pumping is challenging, but there are so many moms on the other side of your phone that are really struggling in the same boat. There's like Reddit groups you can join, Facebook groups.
Yeah.
There's a lot of support. Exclusive pumping is a helpful one. I just like to say it's just peer-to-peer support, not necessarily experts, but they have a lot of really helpful guides there too.
Yeah.
There's no right way. It's just finding what works best for you. And Coddle's here, we're here. You can ask us any questions. You can DM us. You can message us in our Facebook group. We have a Facebook group called the Coddle Parenting Circle. So we're here, and we are available to answer any questions as well, or get you connected if you need some more local support. And thanks for your time. Thanks for bearing with us. We have, of course, our Coddle app is free in the App Store and Android. It's available for you. You can use it any way that you want, but the assistant is super helpful. Me and Becca are constantly evaluating it, and it's doing a really great job. And then some light tracking if it's helpful for troubleshooting, especially milk supply, like if you're weaning or trying to build supply, it's helpful to kind of see like how you're tracking, what's making a difference, especially if you're kind of troubleshooting some of those issues.
Yeah. So we're here to answer questions for another like 15-20 minutes.
Yep.
So if anyone has any questions, please feel free to pop them in the chat and we will take a look. Yeah.
Great. And I think some people wrote in as well.
Yeah, we have a couple of questions that are like pre-sign-ups. So I think this is probably a really common one. A lot of moms mention this. This is something I see in the office all the time too, which is I started pumping because I was having a lot of nipple pain. I'm still having a lot of nipple pain, and now I'm doing it with a pump instead of with a baby. Do I need to take a break from everything if I have cracked and bleeding nipples? What can I do for nipple care with pumping?
Yeah.
Yeah.
Okay. Yeah, that's it. Yeah, that's a tricky one.
Yeah.
Is there should we start with that question, or is there anything in the chat?
Let's take a look in the chat. Let's see. Do you want to see?
I'm just wondering if it will
Yes,
change our.
Let's take a look. Let's take a look in the chat. You and I have different versions of this.
There we go.
Okay. Okay. So, oh, this is a good one. So, for supply, what do you think about power pumping?
Yeah. So again, everyone has their own opinions. I personally find if you want to try it, you of course can. I find if you try it and it really does, like the output is worth the effort, totally do it.
Before you answer, for
Okay.
people who may not know, what is power pumping?
Yeah, great question. So power pumping, there's a couple different plans, but essentially you usually like pump for 10 minutes or 20 minutes and then rest for like 10 or 20 minutes, then pump again, and usually do that like 3 cycles. So pump 10 or 20 minutes, rest 10 or 20 minutes, pump again, rest, pump again.
So you're pumping for like an hour.
Exactly. Like
Okay.
on and off like 3 times for an hour.
Okay.
So I personally find it's so much work. Most people don't enjoy pumping. So doing a full hour of on and off pumping, I just really feel for those nipples. And I'm also thinking of like the mental health that people are in to kind of go through that. I would find personally, again, I'm kind of putting in my own personal like anticipation of what I would be feeling at those moments when I answer the question, but I feel like I would dread that session so much. I would just be thinking about that and be like, oh my God, I have to do this whole thing. And then it is like a whole thing that you're spending almost an hour on, even though you have a little break. So I would say if you're open to it, you can try it. And again, if the output feels like the effort that you put in is worth it, you can definitely do it. I personally find that finding a more sustainable schedule and just kind of like finding that routine that you can just settle into is usually more beneficial for the output, but also like our mental health. So I have had people though that swear by power pumping like once a day to really help build their supply and kind of tick them into that next trajectory that they're hoping for. But I personally find it so much work and maybe the output is not worth it.
Yeah. Any power pumping schedule samples you can share. I did some power pumping as a mom trying to build supply. I definitely would say this is like an early in your pumping journey kind of a time. This is not something that people should be doing long term. The power pumping schedule that I think I found one on kellymom.com, and then there's another website that I use called exclusivepumping.com. And they both have great options. Coddle could also build you an exclusive pumping power hour kind of thing. But exactly what Andrea said, I think it was like 15 minutes on 10 minutes. I was 20 and 10. So it was 20 and 10. So 20 minutes of pumping, 10 minutes. The goal is that you're trying to stimulate 2 letdowns in a row. So you're basically trying to get your body to like fully empty the breast. Fully empty is a thing we were just talking about, actually, that it's never quite fully empty,
real.
but you're trying to empty the breast and then get a second letdown. And so the goal is to do at least 2 long enough pumps that you get that started, and starting in massage mode for the first couple minutes and then switching over, because it's a lot on the nipples too. So I think it is something that again can be really, really helpful. Also partly just as like let me try this, because I think a lot of the time when we're pumping, we want to feel like we're doing everything we can to get that milk supply up, but we have to balance that long term with what's sustainable. I think one of my like most vivid memories from this stretch of time was sitting in my bed with my baby right here, kind of fussy, and me with the pump right here, and just being like, oh my gosh, I don't know how I'm going to make it to 5 in the morning or to 6 in the morning. So I think this is something that I would say you can definitely be paying attention to and try, but it's not a tool that I recommend universally for sure.
Yeah, totally. Same. Yeah. And then in terms of discomfort, I'll just say like What I would say if they're having a persistent pain with pumping, maybe one, if you feel like your flange is a good fit, try lubrication, try lowering your suction. If you're open to more troubleshooting, I would say like the very end that I think like the most helpful recommendation it would be to try the Medela Symphony pump. It's a really gentle but super effective pump. I just worked with a client that's been pumping like for 4 months, and we've done loads of different flange fitting, and then she got comfort, and then really quickly it kind of came back discomfort. Long story, we eventually went to the Medela Symphony, and it was the game changer pump for her. And I've seen that consistently for lots of people. So
Yeah.
different flange, have a lubrication, maybe a different pump, and then really reaching out for help. Scenario, I would say maybe to move to hand expression if you really do need nipple rest and you cannot find a way to get comfort immediately. That can be helpful.
Yep. I think pumping it's a lot of stimulation on the breast. So the other thing that I always check with people about is, are you actually pumping too long? So the pumps typically have an auto setting to turn off after 30 minutes. And some people think that that auto setting is how long you're supposed to pump. And that is not. So typically what we want to see on the rhythm of pumping is we want to see like that initial couple minutes of just getting your breast tissue stimulated, ready to go, and then making that switch over to the real expression part. And then that eventually should really slow down, if not stop. And you should be able to be like, okay, this feels different in my breast. This feels like there's not anything else really coming. If you're in the very early stages, that those cues are not going to be as clear as they will be once your milk supply is really in and you're really like on a rhythm with this. But I usually say no more than 20 minutes for pumping, because that extra 10 minutes can be just super, super irritating. And then the last thing I'll say is lubricant can go either way, right? Because sometimes if you have a very stretchy nipple, a condition called elastic nipples, it can actually make it so slippery that your nipples overstretch, and then they overstretch every time that the pump is pumping. And so that can end up being like really uncomfortable too. So this is where, honestly, I would suggest you should go see someone. That's we're hitting like a troubleshooting with an actual person. And I think that's a really good idea for that level. All right. Do you want to handle the next question?
Sure. So does your supply dip each month when your period starts? Yeah, great question. It can. So I would say like in general, what I've seen is like the first return of period, it really seems to make a pretty big impact when your hormones are really shifting, sometimes even like the first few, and then hopefully it will settle down and not be so dramatic, but it can every single cycle have a little dip. Usually I find it's about halfway into the cycle, and then up until the period starts, maybe the first couple days after the period has started as well. There are some things that you can do. There's some research that CalMag supplement can be helpful just during that period. But I would talk to a lactation consultant and or your OB, your midwife, your PCP. But supplement, I think I'd have to look at my resource. I think it's like 500 milligrams a day. Do you happen to know?
Magnesium?
Yeah.
Calcium, magnesium?
Yeah.
I don't know off the top of my head. That's for moms, not babies.
Yes, exactly. So your OB or midwife, your PCP. But yeah, usually like halfway through the cycle up until the period starts. I would say the first two seem to be pretty impactful. I hear that a lot when they first their period returns. And then, over time your hormones do kind of balance out a little bit, but there is a change in hormones every single month that you have your cycle.
Yeah. The other thing I have heard, and I'm so curious about your thoughts, does the milk taste different when you're on your cycle versus not on your cycle?
I've not heard that.
You haven't heard that one?
No,
I've heard that.
So like they feel like in their baby, like that they
the milk has like a different
reaction.
So that it just tastes different. Anyway, I was wondering.
That's so interesting.
That's true.
Maybe I need to look into that. Yes, I love that question. Cool.
So I think this is a great one. How do I build a stash for work? I'm just meeting my baby's needs now, and I'm going back to the office in 2 weeks.
Yeah, cool. So I love this. I love having people return to work because they're like so stressed, and I'm like, it's gonna be great. And then I usually like sum up with the plan, and they're like, what? It's gonna be this easy? Not that like in practicality it's that easy, but it is usually like more sustainable and easier to kind of fit into your day than it seems initially. So yeah, so what I usually recommend about a month before going back to work to add in one extra pump session per day to kind of boost your supply a little bit, and hopefully to start building a little bit of a stash. And if you can't, and that just kind of brings it up where you give your baby a little bit more, I still find that it's helpful. but pumping about once a day extra than you were doing about 30 days before going back to work. And I usually find the best time is first thing in the morning. So when you're up for the day, not like 5 a.m. when you're like groggy, like, "Oh, is this morning?" No, I would say like 8, 9, 10 o'clock or something. If you're nursing, I would breastfeed first and then pump right after that first morning session of the day. Pump both breasts for maybe like 10 minutes. Put all of that in the freezer, start building a little bit of a stash. It helps increase your supply for what I usually say is like an inevitable dip that's going to happen when you go back to work. So just with the separation with you and baby, the stress that comes with that, even if you find your job like not really stressful, it just is in terms of your body and physiologically, it is more of a stressful event to have that separation with baby. And usually there's a lot of feelings there too. But I would plan for that dip when you go back to work. But when you kind of counteract that, at least if you can, by pumping a little bit before, kind of boost it up. So if it does dip, it's maybe not that dramatic, but it also helps you relax a little bit knowing that you've been preparing for this moment. You've been helping support your supply. You've also been building up a stash. So if you do have to dip into that stash, you don't have to really panic or freak out. Like that's exactly the work that you put in for, is to be able to build that up a little bit before going back to work. And I usually find that maybe like a couple weeks after going back to work, the supply will go back up to what it was if you're able to get into a pretty good routine, which this is a whole other thing, but I usually recommend to pump like every like 3 to 4 hours, usually about 2 to 3 times during like an 8-hour work shift. If you can pump just before and right when you get home, or breastfeed just before and then right when you get home, sometimes you can get away with just once in the very middle of the day, but usually like 2 times is kind of the sweet spot. But yeah, I would plan for it to dip a little bit. So if you can kind of plan in advance to pump about once a day before going back to work for about the first month, that can be really helpful.
Yeah. I also recommend that people do a trial of the unfreezing of the breast milk. So the reason I recommend that is because some babies are very sensitive to like the post-freezer taste. For some women, they have what we call high lipase milk, and that milk just gets a little soapy smelling or tasting. And if your milk is going to do that, you want to know pretty fast so that you're not like, "Oh, look, I've got a great freezer supply." And then you try and offer it to your baby and they're like, "No, thank you. That milk is not fresh enough." So I think, and this is something that I definitely like noticed that I had, and
Really?
yeah,
Oh.
but it was very intermittent. It was very random. So I think it usually is just like you have it or you don't. But I would open some bottles and be like, "Oh my gosh, it's definitely like the highlight base smell." And then other times it would be totally fine. And so I think this is like just really good to know though, because most of the time it is pretty consistent. And there's tricks that you can do when you're storing your milk. And again, there's great resources on Coddle, on kellymom.com, on exclusive pumping, but they actually are much easier to do at the beginning when you realize this, and then store it the way that's going to be less effective, less impactful on taste. And then the other thing is then you can also kind of decide, well, my baby hates frozen milk. I'm not going to spend a bunch of time trying to build up a supply ahead of time. I'm going to like keep pumping a little extra so I can just offer that in a bottle, but I'm not going to really try and store up a huge amount. So
yeah, it can be devastating.
It
They
can.
have a huge freezer stash, maybe won't take it. There are some tips. You can like dilute it with fresh milk.
And a little just like vanilla, I think.
Yeah, totally.
So, but yeah, I think that's worth checking. And then I think the last question that we have for today is, oh, great, this is great. So how to drop pump cycles once you're ready to start the weaning process. And how do you do this to avoid mastitis or clogged ducts? So thank you for dropping that question in for us. Yeah,
great question.
Yeah.
So
start with that one.
Oh, sure. Yeah.
So there's 2 different ways to drop a pump cycle. So one is to pump less frequently. The goal is to pump less frequently. So you can either do that by pumping a shorter pumping session or by spacing out the time in between. I usually recommend spacing out the time in between. I found that shorter cycles just was like very awkward in my body, and I ended up having more issues with clogged ducts, and that's what I've heard from a lot of other parents as well. So I found it was easier to just stretch a little bit, and that worked pretty well for me. Do you have what are your thoughts?
Yeah, so exactly the same. So either across all pump sessions, like wean it down by like, it totally depends on where you're at. Maybe if you're at like 15-minute sessions, maybe wean them down by like to like 13, 12-minute sessions across all of them. and really just checking in with your breast discomfort. So the speed that you can wean is directly proportionate to how far you are postpartum and how much your milk supply, like the volume that you're at right then. So if you have a really low supply, it's going to be pretty quick and probably pretty comfortable to wean. If you are at like pumping 8 times a day and you have a full milk supply, it's going to take a little bit longer.
And what's a little bit longer? Like a couple weeks, couple months?
Usually a few weeks.
Okay.
But I've had people where they have to hang on for a long time because anytime they make a shift, their breast gets so uncomfortable and then they have to kind of go back out, level it out for many more days until they space them out a little bit more. But I would say like 2 to 3 weeks tends to be like pretty average. So yeah, either like reduce the time across all the sessions equally and then kind of keep that, whatever you wean it down by like a couple minutes, keep that for like 2 to 3 days, really feel out how your breasts are feeling, what your comfort level is. If that feels great, and then kind of wean it down by another like couple minutes, keep that for like 2 to 4 days, really checking in with breast comfort. That's still feeling good, kind of keep going down from there. I also find that it doesn't really give people that much relief. They're like, okay, so I can like be done a little bit earlier, but like I'm ready to be done with pumping. What I agree with you. I usually find what people want to turn toward is more of like cutting out a pump session. So spacing out your pump sessions equally a little bit further so that you can actually remove a pump session a day, or start with like removing one, space them out equally. And then again, waiting like 2 to 4 days, seeing how your breasts are feeling comfort wise. If you need to express a little bit more in between some sessions just for comfort, you can do that. So respond to your comfort level, but otherwise see if you can cut out one, space the other ones out equally, wait about 3 days, maybe use some ibuprofen if you're, with your provider's approval, do some ice on the breast. And then after a couple days, see if you can cut out another full one. I usually recommend to start like keeping the morning time ones a little closer together because it's probably when you're going to be more engorged. But the afternoon, evening space, you can space those out quite a bit more than the morning ones. And usually people are really happy to be done with like the later in the evening ones because like the one before bed is all like they hate it. And then overnight ones too hate it. Yeah.
And just also to know, like your supply will start to drop as you decrease pumping. So if you're also nursing and you want to continue nursing, you need to figure out, like, if you just want to stop pumping, you're ready to just nurse. Your baby will take care of this for you. You can drop the pumping a little bit faster because your baby will nurse a little bit more. So if you're like building up your stash, you've hit your, like, we've got enough milk in the freezer to make it until a year, I'm done with the pump, but I'm still nursing my baby and we're going to give frozen breast milk, then you go again slowly, but a little bit faster with that scenario. And then I do think I usually recommend people start thinking about which to drop by. What are you producing the least on? So if you're getting like 3 to 4 ounces when you're pumping in the morning and 1 when you're pumping at 9 o'clock at night, drop that 9 o'clock at night one. That one might have like zero impact on you at all. So just thinking, where am I seeing that I'm getting the most milk, and starting to go the opposite direction.
Yeah, exactly. Great.
Well, thank you everybody for attending. This will be uploaded on YouTube for those of you who may have missed it live. And please check us out on Coddle AI. And we are here for help. Yeah, we want to help everybody be able to enjoy their baby and get the help that they need when things are getting hard.
It's so hard.
Yeah, sometimes, but it's also really fun.
Yes. Yeah, totally. And we'll be doing this webinar free every Wednesday around this time. And we're going to rotate through some topics. So we'd love for you to join again and send us all your questions. Again, you can join the Facebook group, Coddle Parenting Circle, drop them all there. And then once we get to that topic, we'll definitely cycle in your questions.
Yeah. And we picked our topics that we thought would be helpful, but if you have ideas for future topics, we'd love to hear that too.
Yes. Yeah. Sounds great. See you next time.
Thanks, everyone.
Bye.